Okay, welcome everyone to this episode of our series called The Glimmer Room. My name's Amanda. I am a therapist and a group practice owner at Amanda Neves Therapy and Associates. And around here, we, like I said, run the Glimmer Room, which is a series dedicated to glimmers. And in psychotherapy, these are sort of quieter moments that are signals the body is not in a trauma state, where we're feeling more connected and that change is happening in the system. They're really easy to overlook. And so that's why I've dedicated this series to a number of glimmers in our mind and bodies. And today, I'm very excited. We are focused on something called doing everything right, but still feel chronically stressed. A therapist and a naturopathic doctor explain why. And today we have a very special guest. Her name is Dr. Megan Warwick. She's a licensed naturopathic doctor based in Toronto's Annex area with a clinical focus on digestive, immune, and environmental health. She takes an integrative, evidence-informed approach, combining functional lab testing, nutrition, lifestyle medicine, and targeted supplementation to address root causes and support long-term health. Her work centers on gut, immune, nervous system connection, supporting patients with digestive disorders, chronic inflammation, fatigue, and stress-related symptoms. With a background in nutrition and culinary training, she brings a practical, food first lens to care, helping patients translate clinical recommendations into sustainable, real life strategies. In addition to her core focus, Dr. Warwick supports metabolic, women's, and mental health issues, allowing her to provide comprehensive, whole person care, which we really love here at the Glimmer Room. She values collaboration with mental health professionals like us and other healthcare providers to optimize patient outcomes. She's passionate about bridging the gap between conventional and naturopathic medicine, and through both clinical and practice and community education, aims to make complex health information more accessible and actionable. Welcome, Megan.
Thanks for having me. I'm excited to be here and to have this conversation today.
Absolutely. I appreciate you taking time out of your schedule to kind of do this sort of like allied health professional connection in the community. And I know that we really are often targeting the same challenges, right? In your bio, I'm hearing about inflammation and chronic stress and women's health issues and all these pieces. And so maybe we can start a little bit with what got you here in this work. You'd mentioned to me that you got into this field through your own autoimmune journey. What did you learn about your body that conventional care might have missed?
hmm Yeah, so I will start by saying, I think that, which in my field, which is probably similar in yours, I think that a lot of people find their way to this through their own kind of health and learning about that process of navigating it. And for me, I was diagnosed with a couple of autoimmune conditions when I was 16. And so I think that being a younger person at the time, it really informed how I navigated life, going through high school, university, kind of like those key times in life where you're learning who you are. And I also got to experience the process of going through the medical system as a pediatric patient and then shifting into adulthood and navigating, managing my health on my own as an adult, which was really interesting. Um, from a conventional kind of standpoint versus then how I've learned about my experience through that and then, through naturopathic medicine is that the thing that's really difficult as a patient is that if you don't fit really clearly into a diagnostic kind of criteria, and I imagine this is the same in your work as well, it can be really hard to access the right care. And so I think that learning how to advocate for yourself in this kind of system and figure out how to access the right care and what even diagnosis that you have, especially in the world of autoimmune disease, I think that a lot of people don't fit really neatly into one box or one diagnosis. I think it can really limit the care that people are able to access. And what I loved about naturopathic medicine is that it doesn't really matter necessarily what the label is or what kind of category you fall into. We kind of look at a person, we take a step back, we try and figure out their timeline, all the drivers that are leading to not only their symptoms today, but how they kind of got here to figure out how best to support them. And so I think that sometimes this approach for people who feel like they're not getting exactly the amount of care that they need or their health isn't improving quite in the way that they would like, this can be a really helpful adjunct to their management strategy.
I'm really appreciating the holistic nature of this. And absolutely, in my practice, it doesn't really matter the diagnosis or the labels that people come in with. And often that can be an overwhelming thing, right? Often people want answers.
Mm.
And what can be so helpful, at least on my side of the fence, is we don't necessarily need specific diagnostic categories or labels to support what the nervous system is already saying. And it's sounding like that's very much your approach as well, in naturopathic medicine.
Yeah, definitely. Yeah. I think that sometimes people wait for an answer before they can take action. And I
Mm,
think that that can be really limiting. And because
mm,
sometimes there isn't an answer, it's not always that clear. And so I think that we're able to jump right into not only trying to manage, again, what someone's primary concern is today, but looking more long term into, well, how do we prevent further progression or the full-blown development of a condition? That I think is a
mm.
really nice sweet spot for naturopathic medicine in particular.
I love the preventative nature of
Mhm.
that, where so much of the medical model is reactive, as opposed to preventative. And so I'm appreciating really harm reduction as well.
Mhm.
What drew you specifically to working with chronic fatigue and complex illness?
Hmm. Yeah, I think that for me, it was an area I had a natural inclination towards from a personal experience. But actually, going through school, I tried really hard to focus in other areas and learn other areas of medicine because I didn't want to kind of pigeonhole myself in one area. Um, but I think that naturally, not only do I gravitate towards those cases, but I think those patients also kind of have gravitated towards me. And I
Mm,
think that one of the things that I often chat about with my colleagues is that you can really learn anything. You can learn to support any patient with any concern. We have such access to information, and our education was quite robust. However, I think that the lived experience is often that piece that really can help you connect with the patient, um, and provide them care and understanding that they might not be able to get somewhere else.
mm,
From also just the science side of things, I think that there's so much new information coming out in the area of chronic fatigue and complex chronic illness that's really fascinating to me. Especially since 2020, I think that our the research that's happening kind of in the post-COVID, long COVID world is growing quite rapidly. And for anyone who's been practicing in this world for a little bit longer, we know that this is just kind of the most recent iteration of what can happen to people who've had a virus or who have immune system dysregulation. And so this area is really growing. And I think there's a lot of ways that we can help patients that who've kind of fallen through the cracks or aren't able to get a lot of care through other means. Um, and so I think that not only is it something that, yeah, personally is quite interesting, but I think that I can really see how we can move the needle with patients in this area.
You mentioned sort of two things here. And the first piece is disclosure, like disclosure or connection with the people you work with based on your own previous circumstance or current circumstance. And I'm curious if people ask, and how much do you kind of share with them, and how helpful is that in your work? Because so much of the relational work that I do, is so centered on self-disclosure in some ways. And so I'm curious what that's like,
Mhm.
just as an aside.
Yeah, for sure. So I will say on my website, I keep it pretty vague. For anyone who knows me personally, I also I usually am a little more reserved with like what kind of information I will share from a
Mhm.
health perspective, at least at the beginning. Um, And so with patients, I usually am not disclosing my personal health information. However, I think when a patient is describing their experience and I can kind of mirror, or I often use language instead of saying, oh, when X, Y, Z, I often say, oh, when we, like more using that kind of
Mm,
language. I think that people recognize the understanding isn't just because of something I've read in a textbook, but because I understand what that symptom might feel like, or the challenges of trying to navigate the medical system, or trying to explain to friends and family how you're feeling. I
mm.
think it's more from that lens, perhaps.
I really value that. And I know just having worked with so many people, often female identifying folks who in the medical community, you're just having such a hard time with diagnostics or even just a base understanding of what their body is doing and saying,
Mhm.
often not being believed, pain not being taken seriously. And so I imagine that if the people I'm thinking of were to work with healthcare providers such as yourself who can frame it in this way of our understanding is, or when we experience symptoms like, that can go a long way in even managing some of the maybe mistrust, or fear
Definitely.
that can come along with venturing into a new experience with a medical practitioner, right? Because oftentimes, even seeing one specialist can be so overwhelming, starting from scratch or having to explain their history. So I just imagine that what I will call a relational way of being would really create a nice environment or a nicer environment for people to connect and share what's going on with them.
Mhm. Yeah, I think that's a great point. I spend a lot of time in a first session in that trust building phase.
Mm.
And I think that, and I'm sure that you see this quite often in your office, but what can happen for patients is that when you go to doctor after doctor and you aren't getting a clear diagnosis, that builds a lot of anxiety. And then as soon as you get kind of labeled in that category, I think a lot of people's physical symptoms get written off as like a psychosomatic, presentation of a mental health issue. And so it's really important that a patient actually believes that their symptoms are real and deserve, appropriate diagnostic processes and support. And so I work with a lot of people who, yeah, they have so much distrust and rightfully so. And that's where it's so important to work collaboratively, with a therapist, because I think that there's so much medical trauma that people have to work through,
Mhm.
which is just not
Mhm.
quite, my scope. Um, but yeah, I imagine that's a big part of what you're doing as well.
Big time. Yeah, yeah. Oh, I feel like even that, if you've only watched 15 minutes of this whole thing, then what a wonderful takeaway. Believing in your own symptoms, and advocating and finding allied health professionals that will believe you and take your symptoms seriously and at face value. So to get more specific here, speaking of the work that I do as a therapist and that we do at the clinic, we often see people who are emotionally aware, right? Like they do believe in their symptoms and they understand that they're having chronic anxiety or chronic stress and they are reflective and often still feel quite stuck in these stress responses or these stress patterns. And so we might talk a little bit differently about it in the mental health sphere. And I imagine there's overlap, but in terms of your field, I wonder, how do you see chronic stress showing up physically in the people that come to see you?
Yeah, I feel like everyone I work with is like stuck in kind of fight or flight.
Mm,
And whether that be a byproduct of having a chronic illness or just a byproduct of trying to navigate a stressful life. I think that one of the things also I feel like I spend some time talking to patients about is that there's so much that we can do from a naturopathic perspective, whether it's
mm,
diet or supplements or acupuncture. But if someone's living out of alignment with themselves and with their values, it doesn't really matter what we do. And so sometimes it actually comes down to someone's in the wrong relationship or in the wrong job, and we
mm,
can't really out supplement things that are that foundational and have that big of an impact on your day-to-day life.
mhm,
And I think that a lot of people are actually living in that window. In terms of, how chronic stress can show up, there's often some like initial symptoms, I would say, that people become more sensitive to their environment. So whether that's noise, light, just stimulation, people have more muscle soreness and tension. People have a hard time falling asleep. So often people will say they feel kind of wired but tired. So their body feels tired, but they can't fall asleep. So I feel
mm,
like that is kind of my initial warning signs that we're heading down that road. Um, we know that, 70% of our neurotransmitters are made in the digestive tract. And so we also have that vagus nerve that connects, the brain to the digestive tract. Our digestive tract is governed by the enteric nervous system. So digestion is usually something that will be off in an individual that's kind of in a chronic stress state. Um, and it can really go in a number of different ways, but oftentimes people will have like more reactivity to the food that they're eating that they weren't reacting to before, or people aren't absorbing their nutrients as well, so they can feel more tired. People will either have kind of constipation and bloating or urgency and loose stools. It can kind of go either way.
sure.
Um, so the digestive piece is a big part. But I would say there's a couple of other things I'll notice too, which is that when we have chronically kind of like elevated stress hormones, typically blood sugar dysregulation can become an issue for people. So people can have a hard time with weight management, that kind of like feeling hangry or increased cravings for salty foods and carbs are often a big sign that our adrenal glands are kind of under stress. Um, and as our body shifts its attention towards making our stress hormones, oftentimes some of our, especially we see this in people with reproductive cycles, you can start to have irregular cycles or worsening kind of premenstrual symptoms. Oftentimes people's libido kind of tanks. Those are the kind of things we'll see. And then the kind of further progression I'll also see is that with really chronic stress levels, people's immune systems are often kind of suppressed. And so people are going to get colds and flus more often. They're not going to recover as well. And then in my population of patients I often see, it's flares in their autoimmune disease, or chronic inflammation in general.
Mm. Oh my gosh, so much of what you're saying is so overlapping with the nervous system work that we do. And I'm just so aware in how many people do come in to see me, and it sounds like you too, that are in fight or flight.
Hmm.
This wired but tired is exactly so much of what people are saying they're feeling, and not being able to enter and linger into that, ventral vagal, that sort of rest and digest place where I imagine immune functioning is higher, or, can be recharged, to be able to be in that zone, for people who aren't able to stay there. Um, I imagine it's just cortisol all the time.
Hmm.
And of course, from a metabolic perspective. You haven't said that word, but I imagine that is the system that we're dealing with. Um,
Definitely.
mhm, mhm.
Yeah. Yeah. And when we think about it, back hundreds, thousands of years, we lived through famines and we had, tigers and things out in the world that we had to be, our lives were constantly at threat. And luckily, for a lot of people living, at least in Toronto, that's not their day-to-day experience. But our nervous system is still wired for survival. And so our conscious brain can know that we are not facing a threat. And, maybe you don't have a great workplace environment, or maybe you have something with your living environment, whatever that is. Those aren't necessarily life or death kind of concerns, but our body doesn't know that. And so a lot of our essential processes become not essential as our body is tuned to survival.
Mhm.
So our metabolism can often downregulate as our body's trying to preserve resources for a future threat. Um, and so some of the things that we think are essential, like digestion and like having a menstrual cycle, become less important. And
Right.
so that's where we kind of see that from pathophysiology standpoint kind of play out.
And I imagine that's where people end up coming in because they might not be getting regular periods or, they
Mhm.
might have differences in weight gain or loss over time or etc. As you're
Hmm.
saying.
Yeah, and I will say oftentimes I feel like I'll see someone who's quite far down that road. And
Mm,
I always am chatting with people when the fact that, it's easier to prevent a fire than put one out. And so sometimes it's really hard when someone comes in and they're 6 months into burnout and they're experiencing all of these symptoms. It can be really hard to kind of roll that back and get the body into a more functional place. And so a lot of the conversations are actually around, well, what is that first warning sign? And what can we do to kind of shift things so we can prevent the body from going down this pathway, which we know it can for, the next kind of time we find ourselves in these situations, which again is often where I will be referring them back kind of in your direction because
yeah.
I think that's a huge part of it. It's easier to prevent for sure.
Well, based on what you're saying, I'm curious what some of the early signs in the body tend to be that they might either
Mm.
normalize or ignore, get used to, and why might someone push through that over time and then suddenly, I guess, crash?
Yeah, yeah, that's a great question. Um, One of the things I actually find is that a lot of people I see in practice can't actually describe their symptoms. And
Interesting.
so I think that people are so disconnected kind of from that mind body kind of aspect that it can be hard for people to even tune in to describe when they say, oh, my digestion's off. And I have them try and describe it to me. A lot of people can't. And so sometimes a part of that is trying to have someone actually feel safe enough in their body that they can start to actually clue into some of the signs that their body is sending them versus just ignoring them, which I think is people's default. Um, but that being said, it's rare that someone kind of crashes overnight. Usually is a bit of a slow build. And people can usually see in hindsight what those things are. The early signs I often see is someone needing an extra kind of cup of coffee to get through the afternoon because they're feeling tired, or they're still sleeping, but it's not as restorative as it once was.
Mm,
People might skip a bowel movement one day and not really think anything about it, feel a bit more bloated, kind of like energy dips in the afternoon. Again, that kind of you lie down to fall asleep at night, you're exhausted all day, and now you're wide awake. Those are the kind of things I think that we see initially before someone really fully descends kind of into burnout or kind of a crash in that like kind of crash cycle. But I think it's hard because I think most people are kind of overachievers, type A, perfectionists. That's who I see a
mm,
lot in practice. I wonder if that's the same for you.
mhm.
But I think that a lot of people are worried that if they stop and take a break, they like won't be able to start again, if that makes
Yeah,
sense.
absolutely. Absolutely.
Yeah. Like I'd be curious how you kind of navigate those conversations with people.
Yeah, I mean, it's so interesting so much of what we're talking about, it feels like we're dealing with the same challenges, but from different entry points.
Mhm.
And that we're both really working on someone's metabolism. Can they metabolize emotions and stress? And in my world, oftentimes these stressors or these behaviors that sometimes can, really continue the stress, like avoidance or overworking, overeating, undereating, oversleeping, drinking too much. Like some of these behaviors end up acting as blocks, or in my world, we call them defense, to emotion. And that emotion often for many people is tied to traumatic states of aloneness, usually in developmental years. So in my world, it often is so much of the same signs and symptoms. And yes, so many people, not everybody, because a lot of the times people who come to see me in particular, they've gone to therapy before, they've done the CBT, they've done the behavioral activation and all these sort of like skills and strategies on the face of it. But what my team ends up helping with is, can we be more in touch with our bodies? Right? Speaking of our, right? Like all of us, can we work on this connection to start to say hello to what's going on, and slowing down and building that trust that, okay, maybe everything isn't going to crumble to pieces if we slow down for these, next 20 minutes together, right? So yeah, so much of what I see is what you see, and the starting point really is establishing that mind-body connection. That way people can build the confidence in, okay, things aren't going to crumble. And sometimes when things do crumble, or if things, you know, friendships kind of fall to the wayside, or jobs change, or relationships change, that to your point earlier, that sometimes that's actually really important and healthy, for things to shift, because those were the often maintaining factors to begin with in the stress response.
Right. Yeah, that makes sense.
hmm And, so much of the people that I seen, it sounds like in your practice as well, where they are the type A person, right? They listen to the podcasts and they read the books, and their bodies are still their bodies. What, for those folks, do they often miss from your perspective, in spite of them like searching beyond belief for answers? Like for them, what's sometimes in the blind spot, would you say?
Mhm. Yeah. Well, I think the first thing is that people's tolerance, I think, to discomfort grows. And so I
Mm.
think in the normalization of symptoms, that can be a barrier in making change to hopefully improve someone's health. But I think it can become really easy to ignore something that you feel every day, you know? Like if you are tired every day at 3 p.m., that's just becomes your new normal. And so people are less likely to do something about it. I
Yeah.
think also in the world of women's health, we've normalized a lot of symptoms that are common, but definitely are not normal and are often like a not necessarily a warning sign, but definitely some kind of sign that your body's trying to tell you that something is not quite right. And so learning to trust your body again and that these signs are important and to listen to them, I think is a big part of it. Um, but in terms of kind of what is being missed, I think in, or I guess in a blind spot, oftentimes it comes down to really low hanging fruit for people. So for someone who walks through my door who again, is kind of like that high achiever, has been kind of running on empty for a long period of time. Oftentimes we're doing blood work and they usually have nutritional deficiencies that have just been unaddressed. And
Mm,
those are things that can be really simple. Yes, it's not the whole picture, but that's something that, if your body's deficient in a number of different nutrients, it's not going to be operating optimally. So, is that solely causing the problem? No. But if we can remove some of those things as barriers that could be an issue, that can be a big part of it.
mm,
Part of my thought process as well is just having someone learn to feel, yeah, safe in their body. So one of the things I often have people do is, set an alarm or a reminder in their phone for every hour that they're at work. And they can actually check in with themselves. Am I hungry? Am I thirsty? Am I bored? Do I need
mm.
to walk around? Like, am I sore sitting in my chair? Do I want to change my position? Just starting to check into some of those really small cues can sometimes feel safer than doing a complete overhaul of someone's entire, lifestyle.
Yeah.
Sometimes we're just not ready for that. And so finding out kind of where someone's at and what they can tolerate, what is realistic to fit into their lifestyle, because doing a huge change is also, whether it's from a nutrition perspective or a routine or supplements, that can be a stressor in and of itself, right?
Yes.
And so we don't want to add more to someone who's already really depleted.
Yes. I'm curious if how that works for you in practice when often these folks are, have an urgent part inside, like an urgent part of them that
Mhm.
really wants to do the complete overhaul, right? But then they have low energy and might not be able to handle that. I wonder for those folks, how you speak to them and how you support them through doing the low-hanging fruit.
Yeah. Yeah, I think that so when I'm sitting across from a patient, I usually have my kind of list of goals or priorities, and the patient will have theirs. And theirs might be wake up and have energy tomorrow. And from my perspective, I'm thinking, okay, I know they don't have energy because these nutrients are low. Well, if multiple nutrients are low, they're probably not absorbing their food. So I've got to address their digestion. And maybe they need help actually with energy production. So I've got to give them some mitochondrial support. And how can we improve their sleep quality? So that's where my brain goes. But I know that doesn't really matter to the patient. So if I know that giving the patient something that will actually give them more energy tomorrow is actually the thing that will move the needle the most, I'm going to start there versus trying to improve their absorption of nutrients so that they can digest these foods and then maybe feel better 3 months from now.
Mm,
That's often how I will move through things. Um, and I know it's a lot easier for people typically to introduce one thing at a time. Some people
mhm.
want to do it all, some people just want to do one. So I check in with people quite often throughout the visit and we kind of come up with a plan that feels doable. But if someone says supplements are easy, I can exercise, but I can't change my diet, it's like, okay, we'll worry about that down the road.
Yeah.
So it's really one thing at a time and trying to figure out what is realistic to implement, and trying to find a balance between typically their goals are more short term and mine, I'm looking a little bit more longer term, I
Yeah.
guess. Um, so that's typically how I kind of approach things. And I always want to send someone home from their first visit with something that they will have some kind of win within 2 weeks. So they will notably feel something, because if they don't, there's kind of no point to sort of
Mm.
how I think through things.
It's
Um,
hard to keep motivated, I guess.
Exactly. And
Yeah.
that's where also it's important to have realistic expectations. So I always explain to someone, if you take this, this is the timeline of when I think we'll see change. So people at least know. And then give them the roadmap because most people come in and they want to do everything, but they actually don't have the capacity. So I say, this is what we're going to do today, but this is what the next X number of months is going to look like. The key is that in this patient, if you actually are able to give them some more energy, I'm always reminding them that they still are running with a pretty low or empty tank.
Mm.
So a lot of times people will have a burst of energy and overdo it, and then
Yeah.
we kind of start off, or we end up worse than we started. So that's a bit of a problem.
Yeah, yeah. I often tell clients, this is a bit different but similar, it can get worse before it gets better in the
Mhm.
sense of, it's non-linear. Let's slow down. Let's wide scope this, right? Like let's take a look at the everything here and not just one thing. And sometimes taking a look at that one thing can actually be quite helpful because it's less overwhelming, less, um I'm just appreciating the balance here where in your mind there's actually so much going on, and I'm appreciating how full scope you're really looking at folks. And then though working with people, you recognize that they're people with challenges and a life and hopes and wants, and trying to organize how to support them in a way that actually individualizes care, right? I'm
Mm.
hearing a lot of bespoke quality to your work.
Yeah, yeah. I think that I always just go back to like, what do I want to hear as a patient and how would I want to
Hmm.
approach my case, which I obviously have doctors that help me. I'm not doing my own thing, but I
Sure.
always try and think through that perspective of being the patient because at the end of the day, that's the most important thing. And there's so many scenarios in which I've experienced this as a patient or I've heard this experience where you go in, you have an appointment and you walk away and you feel like there was like a disconnect between what
Yeah,
I thought we were talking about versus what they thought we were talking about. I walked away with a suggestion, but I really had a different problem. So I really want to make sure that that's not happening in my office.
that's important.
Hmm.
That's important, yes. Based on some of the pieces in your bio and on your website, you mentioned working with environmental factors. And these can sometimes be like toxins or mold. And how much can those sort of keep people within a stress response? Because it might not be something they're thinking about on the outset.
Definitely, yeah. I so I yeah, it's tricky because there's a lot in our environment we can't control for.
Hmm.
Oh, and everyone has their own kind of genetic makeup in terms of how their body metabolizes and detoxifies and processes just the things in our environment. So those are two things that can be kind of hard at times to balance. Um, but what we do know is that when the body is constantly under threat, and the threat could be any number of things, it's not going to function optimally. And obviously, a big part of that, I think that what I try and focus more on is the physiological kind of causes of stress versus psychological, because I think, again, that's more kind of your scope than mine. But with the environmental piece, I think that's where we often talked in school about this kind of like bucket theory, which is that everyone's body is like a rain bucket, and it's a different size kind of based on your unique kind of makeup and kind of early establishment of your immune system and your digestive system and nervous system. And then as you live your life, your bucket's filled up with all sorts of things. It can be stress and, a health issue and, any number of things.
Hmm.
And we always have to figure out how to kind of expand the capacity of our bucket, keep it from overflowing. I often see people who their bucket has overflowed, and what will often be the story that I see is that people have some kind of genetic predisposition. Then, life, stress, digestive issues, immune dysregulation, all of that goes on. And then there's something that kind of flips the switch and puts things kind of over the edge of where they could cope, and now all of a sudden their body can't. And
Right.
oftentimes it is some kind of environmental thing, whether it's a virus or um, mold, something like that. What those things do in our body is cause kind of like constant activation of the immune system. And so when our body is constantly kind of no, I mean, it's really another kind of form of fight or flight in a sense.
Sure.
Um, the body's constantly trying to keep different things that we're exposed to and different things in our body kind of in the right balance. And so that can be a big piece for people. Um, that again is often not looked at because some of that testing isn't as accessible or robust. It's hard to do
Mhm.
a really comprehensive environmental intake with someone and really understand their full exposure and what their um, kind of risk would be in different scenarios and how their body does process the things it is exposed to. And so I think that's an area I see a lot in practice for sure.
I'm appreciating this bucket theory because I can imagine that when folks, as I've done, Dr. Google,
Mhm.
trying to search what the issue is and maybe being a bit reductionistic of like, okay, this is the one thing, and okay, I need to eradicate all these substances in my house, let's say, and while that might be helpful in the long run, I'm thinking microplastics, etc. That really each person has its own history, has its own DNA, its own predisposition, um, capacity, right? And so all of these things, again, I'm just really appreciating the individualistic nature of this in therapy too, right? So much of the time, and where I find therapeutic approaches sometimes fail us is when they're not individualized,
Mhm.
or when, it's okay, I have this modality and I'm just going to do this modality on this person because it's been shown in, randomized controlled trials to support this level of anxiety. And it's dehumanizing in some ways, which is sort of like another conversation. But the reality of how important it is to earlier you were saying, take your symptoms seriously, but then at the same time see them in the context of the broader self, right? The broader experience physiologically. And someone like you might help them navigate, their histories, their blood work, what they're eating, are they moving, etc.
Mhm.
Hmm.
Mhm. Yeah,
Awesome.
definitely. And what we often will see is that in the same way that you and can't, roll out exactly the same therapeutic process for each person, if a family all grows up in the same home and there's water damage and they're all exposed to the same mold and only
Right.
two people develop symptoms, their bodies are processing their environment really differently. And one of the things that can make our body less um, able to handle these sort of things is when our body's in fight or flight. But it's the same as
Mm.
how, you can grow up in a family with multiple siblings, all experience the same home theoretically, and all come out with different kind of mental health concerns or just
Yeah.
so it's fascinating to see how that plays out. Um, and so that's where, yeah, it does really need to be individualized for sure.
Yes, this is point for naturopathic doctor, point against ChatGPT. Is
Exactly.
is
But
is the point here.
I will say though, it's AI is we're in an interesting time, I think, with AI, and I some people I mean it's a nuanced conversation, but a lot of the patients that I see have done a lot of their own research,
Yeah,
usually not with AI, but just on the internet, and I welcome it because again, they're in the driver's seat. It's their health. I want them to be educated and to be able to make, an informed decision what they want to do. I'm just here to provide them with options, which,
absolutely.
in some capacity the internet can do as well. But it's always fascinating to me the things that people are able to find through AI on the internet. And there's some helpful things and some not helpful things, but it's again information that we're able to talk about in an appointment. So I've had such interesting conversations that really all come back to, suggestions that someone's found out through some AI. And it's always a fascinating conversation.
Absolutely. I welcome it too, and that's again a separate conversation, but often it speaks to just the disjointedness in the healthcare landscape, including mental health. And so when people feel like they need to figure out their own health when the system maybe isn't supporting them or they're not feeling listened to or respected, then of course they're going to do what they need to do to be able to, well, we need to do, I'm sure we've all kind of Googled a symptom here and there to care for ourselves. So I
Mhm.
appreciate that you welcome that too. Speaking in the way of, this series, and this is, I think, our eighth episode in the series, and it's taken some turns. We started with sort of Instagram lives, and now we're doing sort of these sort of webinar features. Um, Glimmers as a focus is really important to me in trauma work, right? Because they are the anti-symptom, there are moments of these connections within oneself, feeling safer and feeling more settled or calmer or confident, any really positive break from trauma symptoms. And so from your perspective, thinking about small shifts, right? These small glimmers, can small, consistent shifts really impact something that feels big, right? Something that people might be coming in with, like chronic fatigue or chronic stress. I know earlier you were talking about low-hanging fruit, right? But maybe if you can say more to
For
sort of small
sure.
shifts.
Yeah, I think, the majority of the patients that I work with in practice are highly motivated and want to do everything, but they often don't have the capacity. And so I think I can respect the thought process of wanting to kind of do everything. I think a lot of people live in the kind of black and white of all or nothing. And you
Right.
hear this where people, if they didn't exercise today, well, then I would just won't exercise this week and kind of throw everything out for that
Mhm.
week and try again the next week. And I think that a lot of people can fall into that thought process. And I can totally see how that kind of can play out. But oftentimes we are starting with really small changes and things that are easy to, bring into someone's daily routine, because that's usually all people have the capacity for. And it's
Mhm.
the most important thing again is also to make someone feel safe in their body so that their body's also receptive to whatever we're going to do. Because a lot of people will react to everything, whether it's supplements or foods. And
Wow.
so if we're going to put someone on a bunch of supplements or change things pretty radically, if they're already feeling unsafe, it's too big of a change. If that
Hmm.
makes sense.
Yes.
And so oftentimes I will, again, yeah, it's we're trying one supplement. We are only going to focus, eat whatever you want, but let's just talk about protein at breakfast. So it's
Mm.
really small things, and we build upon, that kind of atomic habits, habit stacking. Once you start to implement some of these strategies into your day-to-day routine, it's easier to build upon them. And again, when someone is operating with really low energy, they don't have the capacity to typically do a ton of things, or do some of the more involved interventions. And so we're doing things that are easier. I feel like that moves the needle the most. One of the things that, not exactly your question, but one of the things that's actually can be a really big barrier in this area is that I find that for people who felt unwell for a long time, any change, even if it's positive, can be really destabilizing. And so their body is so used to feeling unwell that the change to feeling slightly better, their body can almost be a little bit resistant to because
Mhm.
that feels unsafe.
Mhm.
And so that's where we're moving really one step at a time and
Slowly.
really slowly. And that's also where I think it's so important to check in. That's a huge part of, again, as I said, my first visit is everything we're constantly kind of checking in, making sure that each thing we integrate feels manageable. And I always tell them at the end of the visit, if you do nothing, great. If you do one thing, great, regardless. come back and we'll figure out. And if you come back and say, hated it all, nothing worked, it
Mhm.
was too hard, okay, let's brainstorm
Yeah.
why and let's figure out a new approach, right?
I love that. It's like, let's leave shame at the door,
Mhm.
and make it as easy as possible to, I mean, in my work too, right, to bring in resistance, to allow for resistance. We were saying earlier, often it gets worse before it gets better because systems are that way. They're protective and the hell we know, right? It's like the
Yeah.
body will want to be in a state of homeostasis, even if that homeostasis is not the funnest place to be. Um, and so I'm hearing kind of going slow, one step at a time. And I appreciate that it is so individualized, but I'm curious what often the low-hanging fruit tends to be in terms of, try this one thing, one thing. What do those things tend to be for
Mhm.
the most part?
Yeah. So I think, from a sustainable kind of approach, often focusing on the foundations makes the most long-term kind of change help. Like I think it's just the most helpful long term. And it's not realistic that people are going to be on 1,000 supplements, forever. So we use more of those involved interventions short term to kind of move the needle. And then we want to have something that's sustainable through more of the lifestyle factors. So my kind of low-hanging fruit, there's so many things I would say doing basic lab work and running, like ruling out nutritional deficiencies is
Mm.
kind of, again, if someone is anemic and we're trying to give them more energy, but we're doing everything but addressing that, we're just not going to move the needle, right? And we also have
Right.
a huge overlap between iron deficiency symptoms and anxiety. We see that play out quite significantly. And so many people who menstruate are going to have low iron. So that's kind of something that I'm always thinking about. Um, from a like sleep, I think if someone's not sleeping, I'll pretty much do everything I can to get someone to sleep. Um, so
So
that's
important.
typically where I will start. I often have someone just get protein at breakfast and start walking. Those are typically
Mm.
the things that if we can start there, um, that seems to move the needle. Again, it's can be too overwhelming to do too much at first. So really keeping
Mhm.
it simple. But if you go for a 10-minute walk after each meal, if you try and just make sure you do eat breakfast, it is the most important meal of the day. You know, we try everything that we can really to get someone to sleep, correct some of those nutritional deficiencies. That can really move the needle for most people.
That sounds like so hopeful. Like, I'm just noticing how much hope I'm sitting with from that perspective, and that there are actually so many entry points to change,
Mhm.
and that it's sort of a stepped process with you and with me too, right? Like if we go in gunslinging and trying to do too much all at once, it overwhelms the body, it overwhelms our system, defenses show up physiologically or psychologically or otherwise. And that's such a big takeaway that I'm hearing. It's like, especially for the folks who are dealing with perfectionism and overachieving, overfunctioning, which are trauma responses, that actually you can go further by doing less.
Mhm.
And consistency as well sounds important.
Yeah, I think we've
Some,
really overcomplicated health. It doesn't need to be like we've overcomplicated
yeah.
nutrition, exercise, health. It doesn't need to be that complicated, I think.
And often people come to, I imagine they would come to you to cut out the noise. It's like, okay, just help me refocus on the things that are most important instead of trying to do everything perfectly, which
Mhm.
is throwing gasoline on fire, right?
Exactly.
Somehow this time has flown. It's flown. And so I guess I'll ask sort of the last question, which is not something I had prepped you with, but it is something that I ask everyone who I have on this series, on the Glimmer Room. And don't worry, it's an easy one. But I'm curious for you, what brings you glimmers of safety and connection in your life, in your work? What helps you feel those moments for you?
Yeah, it's a good question. I think for me, connecting with other people is one of I think that's the thing that I value most, whether that be with a patient or with a friend or like with someone I pass on the street in my walking route every day. All of those like little moments, I think, of connection with other people, I really, really love. Um, and like that's my primary thing, I would say.
Hmm.
But if I were to kind of go a little bit further, I think that spending time, enjoying this beautiful weather and eating good food, and those are the things that in my day to day that I wake up looking forward to do. And also things I like to do with other people.
Hmm.
Cooking and
Hmm.
spending time outside with other people are kind of my favorites. Um, so yeah, that's how I would say I would answer that.
Beautiful. I love the simplicity.
Mhm.
Connection, walking, food. Absolutely. It's so
Mhm.
human. Thank you for being here today, all of you, the folks on the rewatch, and to you, Megan, I appreciate your time. Where can people reach you, find you?
Sure. Yeah, so I practice in Toronto and across Ontario. So I'm in the Annex area, so I'm at Bloor and Bathurst, and I have, website and Instagram and all of those things, which is just my name. And you'll also, again, if you're in the area, you will probably see me walking around. I'm always walking around the area. Um, but yeah, so that's sort of where you can find me.
Awesome. Thanks everyone for being here. My name is Amanda Neves from Amanda Neves Therapy, and this is the Glimmer Room. I hope you all have a wonderful, wonderful day.